My name is Dr. Elizabeth Cody. I'm an orthopedic foot and ankle surgeon practicing out of Hospital for Special Surgery in Stamford, Connecticut. I treat the whole range of conditions throughout the foot and ankle, ranging from the ankle all the way down to the toes. So I treat injuries, things like ankle fractures, Achilles tendon ruptures. I also treat ankle and foot arthritis, so I do ankle replacements. I treat complex deformities throughout the foot and ankle, including deformities above the ankle all the way down to flat feet and bunions. I think it's extremely important to listen to the patient. I think a lot of times the patient, you can figure out exactly what's going on just by talking to them. So it's really important to me to listen carefully to exactly what's bothering a patient. And then there's so many possible places a problem could be coming from, even occasionally multiple places. So it's really important to me to figure out exactly where the problem is coming from. Often there's what seems to be the problem, but that's coming from an underlying problem. So really trying to figure out exactly what's causing the problem and then thinking about the best way to fix it for that particular patient. My goal as a physician is to help people achieve whatever their goals are. Every patient is completely different, so I really try to understand where a patient is coming from, what they're hoping to achieve, what all the intricacies of their problem are, and then we try to work together to figure out the best possible treatment plan for them to get to where they want to go. Total ankle replacement is a procedure that's definitely become more common recently, and it's a really great solution for patients with bad ankle arthritis. Previously, we did not have great treatment options for patients with ankle arthritis, and so ankle replacement has really filled a huge gap there. That is my favorite thing in the job, just seeing how happy patients can be after surgery, seeing somebody who comes to me totally defeated and depressed because of their foot, and then seeing just the complete change in how they are after surgery when the problem is fixed and they're no longer thinking about their foot and ankle. That is definitely the best thing about this job.